Welcome to the Building Healthy Equitable Communities, a new virtual training series from ChangeLab Solutions, where we explore the elements of a just community and how to create the conditions that will help all children and families thrive. Over the next 6 months, we'll be releasing 6 collaborative episodes which offer training and discussion on how policy plus community power can advance health equity. You can see the full schedule here and on our series homepage. Our kickoff episode explored health equity as a principle in practice and set a high-level theoretical framework for how to use law and policy to reduce health disparities. We just wrapped up our second episode, which explored policies and systems that support working families. Both of these episodes are now available for your viewing on our website. The link is on the screen. Today, we're here for episode 3, Building Healthy Equitable Communities Through a Just Food System. In case you're wondering what exactly is an episode, let's recap. Each episode contains 3 things. First, it contains a blog post which shares the consequences of laws and policies that don't take health equity into account and how we can respond. In episode 3, we looked at the challenges of developing and implementing effective food policies, highlighting 8 existing policies whose impacts fall along a spectrum of harmful to helpful. We'll then host a webinar that provides both on-the-ground stories of innovations from community health leaders, as well as resources to support your work in healthy change-making. Today's webinar explores how institutional food purchasing can contribute to a more just food system and promote health and equity. Finally, we'll close each episode by moderating an expert panel. These experts will be in conversation with each other and responding to questions from you. For this episode, please join us next Tuesday, June 26th, for a panel featuring Colleen McKinney from the Center for Good Food Purchasing, Kate Siebold from Minneapolis Public Schools, and Katie Bishop-Kendrick from the American Heart Association. Please note we will not be doing Q&A during today's webinar, but instead collecting your questions for our expert panel. So please make sure to submit your questions as they come up in the chat box on your screen, and we'll pose them to our panel on Tuesday. And even if you can't attend the panel, you'll receive a post-event recording if you go ahead and register. So you can put a face to the voice, this is Kim Libman. I'm a program director at ChangeLab Solutions, where I lead our work on food policy. I've worked as a researcher and advocate at the intersection of public policy and health for over a decade. In addition to food systems and policy, I've worked on issues such as hospital community benefit and affordable housing, and conducted health impact assessments and community-based planning. On today's webinar, I'll be joined by Brett Jones, the Executive Vice President of Evergreen Cooperatives, a Cleveland-based initiative focused on creating living wage jobs in 6 low-income neighborhoods. Brett oversees the growth and development of Evergreen's Fund for Employee Ownership, which helps companies convert to an employee-owned structure. He also supports other cities in adapting Evergreen's anchor institution-based model of economic inclusion and community wealth building. I met Brett while on tour of Green City Growers, one of Evergreen's co-ops that produces high-quality, sustainably grown lettuce, gourmet greens, and herbs in an impressively large and state-of-the-art greenhouse. They are a supplier to leading grocers, restaurants, and food service establishments throughout Northeast Ohio. In today's webinar, we'll talk about food procurement strategies that advance health equity. I'll start the webinar by defining what we mean by food procurement and equitable procurement. We've invited Brett to bring the impacts of equitable procurement to life by sharing the story of Evergreen Cooperatives and the tangible benefits for worker owners, their families, and their communities that result from anchor institutions' procurement of Evergreen's goods and services, such as the fresh produce sold by Green City Growers. I'll then talk more about the connections between health equity and food procurement before sharing steps and resources for putting these ideas into practice. To get started, I want to clarify what we mean by the term procurement and how people typically connect food procurement and health. Procurement is the process of finding, contracting for, and acquiring goods or services. For government and institutions, this usually includes a competitive contract or bid solicitation process, which ensures equal opportunity for all potential bidders and that purchasers get the best value possible for the money they spend. Government agencies and large institutions like hospitals and universities are often some of the largest food purchasers in a community, offering them numerous opportunities to promote nutrition and wellness among residents and staff. For example, government and institutions sometimes procure food to provide meals for people through programs such as senior meal programs, summer meals for children, and after-school programs. Government and institutions also procure food to sell to employees and the public from vending machines in cafeterias and at concession stands on their property. And some government agencies or institutions contract with vendors and food service companies to purchase and or serve food on their behalf. Establishing nutrition standards in these contracts ensures that the foods sold or served include healthy options. Adopting healthy food procurement and vending processes to require that the food sold or served on their property is one way to ensure that they meet these nutrition standards. Some of the mechanisms to promote health through procurement are contracts, policy, and permits. Both government and institutions use contracts with businesses to establish requirements or standards for food or food services they provide. For example, contracts can be used to require that food meet nutrition standards or that the food come from local sources. Governments can also use policy to establish rules and regulations for foods they purchase and serve. For example, a chief executive can issue an executive order requiring government agencies to follow food service guidelines for all foods served and sold on government property. The chief executive typically is the governor, the mayor, or the county executive officer. Similarly, a state legislature can enact a statute, or a city or county council can enact an ordinance requiring that all food sold or served on government property meet food service guidelines, with the guidelines incorporating these standards. For all of these strategies, typically a local health department is directed to establish the guidelines and monitor their implementation. Finally, local governments may use a permit process to regulate the sale of food on government or public property. The permit can require that vendors comply with or specify types of food and drinks that can or cannot be sold in certain locations, for example, such as near a school. So what is equitable procurement? Sometimes contracts from government or institutional buyers are intentionally leveraged to provide income and employment to specific priority populations. Examples of these groups include women, people of color, and people who have formerly been incarcerated. The Government Alliance on Race and Equity, also known as GARE, recommends that local and regional government dollars used for contracting and procurement should benefit the communities they serve, proportionate to the demographics in those communities. Equitable procurement, or inclusive contracting, is the process of creating an environment for businesses owned by priority groups, such as people of color and or women, to participate in government or institutional procurement and contracting. Some contracting processes use the terms minority and women-owned businesses, MWBEs, historically underutilized businesses, HUBs, and small business enterprises, SBEs, to refer to the types of businesses they aim to include. Now I'll turn the webinar over to Brett to tell you about Evergreen Cooperatives and how the practice of equitable procurement has transformed lives and neighborhoods in Cleveland.
Thank you, Kim. Hello, everybody. This is Brett Jones, as Kim mentioned, from Evergreen, and very happy to be on the webinar today because I really feel like there's a close tie to what we do and to overall health outcomes. And so at Evergreen, the Evergreen Cooperatives were formed by the anchor institutions, Case Western Reserve University, University Hospitals, and Cleveland Clinic, in an effort to really create wealth in 7 target neighborhoods in the greater University Circle area, which is really around our anchor institutions. And the idea there was that they would, really procure from these locally owned companies in an effort to do their part in building wealth. The analysis that went into which companies to start was a long and arduous process, but one that yielded 3 businesses of ours One is a commercial laundry, one is a construction company, and the last one is Green City Growers, which is our hydroponic greenhouse that is in the central neighborhood. And that's probably one you guys want to hear most about today, but I think it's important to recognize that, procuring things other than food can have health impacts and affect health outcomes. And so what we've done is we've operated these companies since 2009, and we've had home buying programs that help stabilize a neighborhood, as well as car buying programs, which help people get back and forth to one of our 3 locations. And so things have gone really well to this point. All 3 companies are now generating profits and sharing those profits with the employees, and we're really ready now to take the show on the road, if you will. And so let's go to the next slide there. And so the 7 specific neighborhoods were chosen because the median household income is low, and generally these folks that live in these neighborhoods are either chronically unemployed or disengaged from the workforce altogether. And the anchor institutions really feel the brunt of that, particularly our healthcare systems, when people really are using the emergency room as the primary point of care, and really just aren't eating well and aren't living as well as they possibly could. And so to combat that, right, the anchor institution realizes they can't hire everybody. One, because of maybe some skill sets or prior job experience. And so rather than trying to hire everybody, they realized they could use their dollars to impact lives and transform communities. And so the anchor institutions are very big customers of ours. They are not our sole customers. And so for any anchor partners who may be on the call, what we try to do with our anchor institutions is we try to keep their percentage of revenue for our cooperatives to about 30%. And we formed worker-owned cooperatives because we felt like that was the most impactful way to really do economic development, right? So it is impactful certainly to patronize local businesses that are sole proprietors or partnerships, but what we found is that even in those instances, the workers may or may not getting a living wage. It really is dependent upon the owner, but those owners certainly don't get profit sharing. And so when you're talking about really trying to have impact social and economic indicators and key performance metrics, it's really about getting as much money and as much resource into the hands of the target demographic. And so that is why we chose worker-owned cooperatives, because we feel like it has the most impact. Okay, and so here are the 3 cooperatives and Evergreen Business Services. So you can see in 2009, our commercial laundry was kicked off, and it provides laundry services to our anchor healthcare partners. Then 2010, we kicked off Evergreen Energy Solutions, where we do solar, and we do lots of LED lighting retrofit. And then in 2012, which is Evergreen was kicked off, Evergreen Business Services was kicked off. That is today not a worker-owned cooperative, but provides support to the other 3 worker cooperatives. And then in 2013, we kicked off Green City Growers, which is the largest, at that time was the largest urban hydroponic greenhouse in the nation. It's 3.2 acres under glass on a 12-acre plot and can produce roughly 300,000 heads of lettuce a month. And so at the time of this slide, we had 123 employees. Since then, our anchor partner, the Cleveland Clinic, has stepped to the table yet again and delivered maximum and really amazing community impact. We now are doing laundry. We have a laundry contract, with the Cleveland Clinic, and it has actually taken our employee count from 123 when I produced this slide to about 250 now. So we've actually just about doubled, and really we're able to do that through the partnership with our anchor institution. And just again mention the impact of that contract on the employee owners for the laundry. In 2017, Let's say in 2018, the first quarter of 2018, the laundry employees earned more profit than they did in all of 2017. And so you can just imagine that as this contract and this partnership with this anchor institution clips along, that this profit sharing and these living wage jobs, which are about $12 an hour to start, are going to really transform a lot of lives in the greater Cleveland neighborhood. All righty. So I've gone over a little bit of the history. There is more of it here. Evergreen it's a blend of nonprofit, which is Evergreen Cooperative Corporation, founded in 2011, and for-profit businesses. And so it's a little bit of what we call the Cleveland model, which is when you use economic development, when you use a targeted economic development strategy, like worker-owned cooperatives. That is really what we call the Cleveland model. And it was spearheaded by the Cleveland Foundation in partnership with the anchor institutions to come up with our three that we have today. And we'll talk more about the final bullet, which is a fund for employee ownership, towards the end of the presentation. But this is just a brief history of kind of how things got going. So we spent some time on laundry. Part of what we found to be important for the businesses that we chose was really the workforce engagement opportunity, right? So we didn't think that it made any sense to do an aerospace cooperative because the people who needed the economic support the most just aren't aerospace engineers. And so laundry made a lot of sense because it was a huge, huge anchor spend, and it was also a workforce engagement point that wasn't a barrier to entry for the employee owners. So generally folks can show up to our laundry on a Monday and be running their machine on a Thursday, right? And so quick and clear paths to earning and ownership are available due to the types of businesses that we chose. And so Green City Growers is a very similar type of business, right? It's not as complicated as aerospace, but there is some complexity to growing leafy greens. And part of that complexity is entomology. So we release about 3,000 ladybugs a week, so we don't need to spray pesticides. The ladybugs eat the bad bugs. And then there's the grower, right? The person who's responsible for really the yield and production within our greenhouse. And so what we found to be really exciting at Green City Growers is that folks are moving on to other growing opportunities in other states. And as they do that, the worker cooperatives who are either in harvesting or in planting or in seeding are moving up. And so you've got a picture here of, on the left, Ernest and Spike, who were early cooperative owners for us, and they're holding their certificates. And then Ernest on the left started off and on the packing line and is now the general manager. And so you can imagine for a gentleman like Ernest, moving from just sort of putting lettuce into a clamshell to actually being the general manager of the facility, that upward mobility has significant economic impact on Ernest's life and on the lives of everybody living there. So let's see, what do we have next here? And last is Evergreen Energy Solutions. Won't spend too much time here. Very similar story of upward mobility, changing lives. And so what the anchors find to be a real benefit is that sometimes you have folks who may have a colored past and therefore aren't able to work at the anchor institution directly. But the anchor institution is very prideful on the fact that they're able to engage all residents and all types of citizens in our community through the Evergreen Cooperatives. And so we're very friendly. We have very friendly hiring practices for those that are considered the hardest to employ. And so our engagement strategy really does help. And so if you can imagine, there is a woman who works in one of our cooperatives who has 8 kids. And those are all her kids. She's 37. And people often ask about the number of jobs we've created for the amount of money that's been invested. But I think they forget about the fact that when you hand someone a paycheck, that really does affect everybody's life and their family. And so it's fair to count Keisha as one job, but I think if you're really trying to understand the economic impact, you have to really count 9 people because it's Keisha and her 8 kids. And what we found is that, so we locate the companies inside of the urban areas, reducing transportation timeframes, right? So one of the biggest killers that we've noticed for quality of life is spending your entire day on public transportation, right? And so what happens is you get home and you're not in the mood to necessarily maybe cook a healthy meal, or you're not in the mood to spend time on homework, and you yourself may not be getting enough rest. And so really we realize that our economic development strategies have broad and far-reaching health impacts and really on social and economic impacts. And so we're proud to do our part, but we realize it does take an ecosystem of community-based organizations to really lift the entire community. But we realize that a paycheck is where it all starts, right? Because it's hard to pay attention to healthy meal messages or see your primary care physician or any kind of healthcare message if in fact you are hungry and don't have any cash, right? So we think that removing that economic barrier really creates fertile ground for all other types of justice-related messaging. I think I skipped a slide here, so I'm going to get back. So this is Evergreen Business Services, certainly the least sexy of all of the companies that we have, but crucial nonetheless, because what we do out of this office is we really provide support to all 3 cooperatives, and it is designed to be a competitive advantage for our worker-owned cooperatives in that each company doesn't need to staff the same position 3 times, because we could just staff it once at Evergreen Business Services. And so this group is a group that I work in, and we're not designed to make a ton of money. We're designed to really just break even via the fee structure, but to support the growth and development of worker-owned cooperatives. So, here's our new summary. We now at least 230 employees. 83% living in the city of Cleveland, which was our goal and the design of the work that we do is really to impact the densely populated in the core urban areas. As you can see there, 40% reentry, which I think is a little bit higher than that, but that's really something that's important for us, because if there's any member of the community that gets left behind, then I don't think the community has been successful, right? And so you got to kind of you have to lift all ships with the tide. And so being able to pay attention to reentry for us is really important, and it's a really prideful point for us. There are some pieces of media there that you could dive into, but I think at the moment, so other updates. These are some updates on Greater University. GUC stands for Greater University Circle. So 45%, which is our target area. And on the bottom right there, you get to see Orlando Sr. from Evergreen Energy Solutions. He got a chance to go and hang out with President Obama when he was in office. And so, and this was a part of a My Brother's Keeper initiative. And so the work that we're doing on the economic front is getting some national recognition. And you can see Orlando looks a little nervous to be standing there with the president, but I think he did a really great job when he was there. So we've pretty much operated on a single pillar approach since 2009, and that is really to direct anchor spending to worker-owned companies in core urban areas and disinvested neighborhoods to get those residents and citizens engaged. And what we've realized is that starting new companies of scale from scratch is really difficult. So we've looked at other opportunities to create more economic justice and really to protect jobs. And so we're taking a new pillar, we're adding a pillar to sort of the operating model, and that's where we're going to acquire companies that are existing today and convert them to employee-owned and then support them as worker-owned cooperatives the way we have our other ones. And really the acquisition strategy or acquisition targets, if you will, are companies that really have 3 conditions, one of which is the owner is looking to exit and doesn't have a strong succession plan, that the company employs 25 people, and most importantly that the company provides by its nature low to moderate income wage positions, right? And so we realize that folks who are living in these neighborhoods that are already employed generally are taking these low to moderate income positions, and if we were not to step in and acquire the company, that the company would close and dislocate all of its employees, many of whom we feel probably live in the neighborhoods that we're trying to serve. And so we're adding this new pillar for acquire, convert, and support, really looking to target the same population and really provide the same community support to the same people, just in a very different fashion than startup, which is more like acquire, convert, and support. And I think that is all I have. I hope I didn't run over. And I think we're going to open it up for a couple of questions. Or am I passing it back to Kim?
You're passing it back to me. We do, so we have about a minute. There is one question that's directed at you, Brett, that came through. And since we have a little bit of time, I'm going to take us a little off script to just ask you the question. The question is if this work is based on any other models or earlier projects, or did you come up with this from scratch? And then is there anything that you would edit in the future or do differently?
So the model is really based upon, so worker cooperatives have been in existence at the beginning of time. The notion of several cooperatives in an enterprise or in a family we took that model from Madrigal's Basque region, where they have the Madrigal cooperatives. The group does something like $30 billion in revenue, this group of cooperatives in Madrigal. So that's what we wanted to make sure we understood how to create cooperatives that were independent businesses but would operate in a family. And then the notion of using worker-owned cooperatives in partnership with anchor institutions as a targeted economic development strategy is one that originated with us, with Evergreen. What would we do differently? We would really, out of the gate, make sure that we had subject matter experts running the companies. There were some very thoughtful individuals, MBAs and community development people, who came up with the idea for the laundry. Spent $7 million buying laundry equipment and getting this laundry started, and then tried to run it, right, instead of bringing in a laundry professional. And as soon as we brought in the laundry professional, things turned around. And so we would still do laundry. I mean, we think laundry is an awesome worker cooperative because it's contract based. But the only thing I think we would do differently is that we would make sure that we have good, strong subject matter expert leadership.
Cool. Thanks, Brett. I really appreciate you joining us today and sharing the Cleveland model and all the examples that you offered about how leveraging these partnerships with anchor institutions works to build community wealth, and in particular, what you shared about the kinds of good jobs and meaningful life improvement that this creates. So next up, I'm going to dive into talking about the intersections between procurement and health equity. Just as a reminder, this is Kim Libman. I'm a program director at ChangeLab Solutions, specializing in food policy. Here at ChangeLab, I'm part of an interdisciplinary team that creates innovative laws and policies to ensure health for all. At ChangeLab, we produce research as well as offer technical assistance, so please bear that in mind as we go along today. And just a quick disclaimer, ChangeLab does not enter into attorney-client relationships, and of course nothing that we say on this presentation should be construed as legal advice. So how exactly is procurement connected to health equity and, of course, to equitable procurement? So according to the National Academies of Science, health equity is the state in which everyone has the opportunity to attain full health potential, and no one is disadvantaged from achieving this potential because of social position or any other socially defined circumstance. Health equity has also been defined as social justice in health. I think what's important is that at the foundation of this concept is the understanding that differences in health that are experienced between different groups in our society are unjust, that they're avoidable, and really important that they are not the result of genetics or biology, but instead result from systemic discrimination and social exclusion. Working toward health equity means that everyone gets what they need to thrive and maximize their well-being. And because people have different needs and capabilities, there is no one-size-fits-all solution to giving people and communities what they need to live well and achieve their full potential. There are two other important implications to the definition I just shared about health equity. So first, as a society, we have a moral and ethical obligation to reduce disparities in health. The second implication is that because laws and policies have historically been a vehicle for institutionalizing discrimination, it's really important that we consider these as essential tools for undoing that discrimination and advancing health equity. So in the context of food procurement, addressing health equity requires us to reframe government and institutional purchasing so that it intersects with health in ways that go beyond nutrition and healthy food access. We need to use it as a tool for achieving health equity and food justice in food systems by seeing procurement as a strategy for creating good jobs, economic development, and environmental sustainability for those who need it the most. So the Center for Good Food Purchasing manages the Good Food Purchasing Program, which is a nationwide initiative that works with institutions to establish supply chain transparency from farm to fork and shift towards value-based purchasing. As a reminder, next week's online panel presentation, The Expert Continued Conversation, will include Colleen McKinney, the Associate Director of the Center for Good Food Purchasing, and Kate Siebold, the Farm to School Coordinator at Minneapolis Public Schools, which is a school system that implements the Good Food Purchasing Program. So it's a great opportunity to hear from somebody who works at both the systems level and the implementation level on actually executing equitable procurement that really aims to change the whole food system. ChangeLab Solutions partnered with the Center for Good Food Purchasing to develop this infographic called Institutions Buying Food for Health and Equity to provide a framework for how equitable food procurement can contribute to a more just food system. As we saw in Brett's example of Evergreen's cooperatives, when government agencies and large institutions make purchasing decisions based on good food values or good values in general, it produces wins for community wellness, the local economy, and the environment. Now let's look more closely at this framework for connecting food procurement, equity, and health. So as I mentioned earlier, nutrition standards and food service guidelines are one strategy that is very often used for using food procurement policies to promote health. An example is that children are now eating more fruits and vegetables at lunch due to the updated nutrition standards in the Healthy Hunger Free Kids Act. In the context of this webinar's focus on health equity, it's also important to consider who it is that typically eats food served from governments and institutions. So most often this food is served to people from groups that are already at increased risk for or overburdened with diet-related diseases like hypertension, diabetes, and obesity. Specific examples here include people like low-income seniors, children from food-insecure households, and people living in institutional settings where the institution controls everything that they eat, such as correctional facilities and psychiatric hospitals. Building on our earlier discussion of the benefits of equitable procurement, supplier diversity programs help counteract disparities in access to opportunity for diverse businesses, including ones that are owned by women, people of color, veterans, and people with disabilities. For example, the federal Randolph-Shepard Act and similar laws at the state level require that legally blind vendors are given priority to operate vending machines and other concession services on government property. In 2015, the program generated almost $700 million in gross income for thousands of blind vendors across the country, including a geographic preference in food procurement policies that prioritizes foods grown and processed regionally can have a big impact on local economies. This is true in urban areas like we heard about earlier in Cleveland, and institutional procurement can keep dollars circulating in a region so that they can stabilize and grow local economies. Local preferences can also be especially beneficial in rural areas. consider that every dollar spent on local food generates another 40 cents to $1.60 in economic activity. 1 out of every 7 workers in the U.S. works along the food chain, yet many of these jobs come with low pay and dangerous work conditions. Procurement policies can help to improve this. So Brett shared some great examples with us earlier about how Evergreen Cooperatives and the Green City Growers doesn't just create jobs, but creates good jobs with real wealth-generating potential for the people who need them the most. And last but not least, procurement standards that influence animal welfare and environmental sustainability also have important implications for health equity. Higher welfare standards for farm animals are also good for public health and the environment. So in addition to doing great things like preserving the effectiveness of antibiotics by reducing their overuse in agriculture, these standards can also improve conditions for people working on farms and in meat processing facilities, which are notoriously dangerous jobs. Additionally, the tropical storms and flooding that climate change contributes to are increasingly recognized as an environmental justice issue. Food procurement offers local governments and institutions a policy lever for taking action on this global challenge. If U.S. public schools reduced their meat purchases by 30%, they could reduce their carbon footprints by 700 million kilograms at no additional cost. So before we wrap up today's webinar, I want to go over some steps that you can take to make the information Brett and I shared actionable and highlight resources available from ChangeLab Solutions and other national programs that support equitable procurement. So at ChangeLab Solutions, we think about the process of changing food procurement policies as having 7 steps. Here I'll go through these 7 steps and I'll highlight some important questions to ask yourself as you approach each step in this process. So the first step is taking inventory. And here it's important to ask exactly what policies and contracts exist and if there are any gaps that need to be addressed or new policies and standards that need to be put in place to cover a section of the food system that maybe isn't currently being addressed. The next step is finding your partners. So you need to ask yourself, who needs to be involved? Who cares about this issue and why? Who are some of the key stakeholders that have unofficial power that also need to be engaged? And how will you build a coalition of supporters to support the change you hope to create? I just want to flag that sometimes those unofficial stakeholders include important people like food service directors that do a lot of decision making around what actually gets purchased and served in a particular kitchen or cafeteria setting. And we need to consider them important decision makers in this process. Third, identifying control levers. So who decides what happens and where? Who officially has the authority over food procurement? And how does this vary by program or setting? Step 4 is selecting standards. I'm not going to go through a list of them today, but there are lots of existing food standards out there for vending machines, cafeterias, concessions to pick from. And so in this step, you'll need to define exactly what it is that you're considering healthy and what other parts of the food system, like jobs and the environment, you hope to address through your procurement strategy. Step 5 is to actually adopt a policy. Here you'll need to consider at what level are you going to set your policy? Are there fiscal implications to consider? Will it include things like positive incentives? And how is it going to be monitored and enforced? Step 6 is implementation. And here you'll need to think about a few things. So 1, how are you going to keep your coalition involved? It's important to remember that having a coalition of supporters isn't just a way to create political pressure to get a policy passed, but the coalition is important in terms of actually moving forward with implementation and monitoring. This is also where you're going to need to establish new contracts, which can be a lengthy process and require quite a bit of negotiation. Sometimes you'll even need to find new vendors who can provide the kind of healthy products that you're looking for. And sometimes at this stage you have to think about phasing in new contracts or products over time. And then the last step is enforcement. So you want to educate everyone along the supply chain about the new standards, set strong contacts, and monitor the change over time. So there are a lot of organizations around the country that offer tools and resources as well as technical assistance for creating and implementing equitable food procurement policies. Earlier I mentioned the Government Alliance on Race and Equity. They have a great guide available online called Contracting for Equity, Best Local Government Practices that Advance Racial Equity in Government Contracting and Procurement. I've also mentioned the Center for Good Food Purchasing. We'll hear more about them next week in the continued conversation. There's also the Real Food Challenge, which leverages the power of youth and universities to create a healthy, fair, and green food system. And finally, the Democracy Collaborative, a national leader in equitable, inclusive, and sustainable development through their Community Wealth Building Initiative. They offer tools and resources as well as research for engaging anchor institutions in community wealth building and developing cooperative enterprises. So I want to say thank you to Brett once again. If you have questions about procurement and health equity, please be sure to add them to the Q&A comment box or email them in real time to our expert panel next week. You can register for this session on the series homepage. And if you're interested in learning more about health equity, I'm excited to announce that Episode 4 will be launching in August. It will explore comprehensive city planning as a driver of health and equity. And then finally, I want to just tell you a little bit about some of the resources and tools that ChangeLab Solutions offers to help you implement healthy and equitable procurement policies in your community. The resources listed here include the infographic that I discussed earlier and a companion fact sheet called Establishing Healthier Food Service Guidelines for Government Facilities. We also have a guide called Homegrown, Implementing State and Local Preferences for Food Procurement, which provides an overview of the factors affecting whether a state or local agency may actually procure locally produced foods and agricultural products. We have two model policies, a state version and a local version, in guides called Healthy Food Service on Local Government Property that can be used to help enact food service guidelines and set nutrition standards for food and beverages served or sold on government property. And then we have Understanding Healthy Procurement, a guide to how governments can adopt a healthier food procurement policy and also lower overall costs. I also want to mention that in the fall we'll be releasing an issue brief in partnership with Healthy Eating Research on policy levers to improve the food and juvenile justice facilities. And also this fall releasing our Blueprint for Collective Action, a guide focused on how communities can address health disparities. Thank you very much. Here's contact information for both Brett and I if you want to stay in touch or share your questions or comments with us. And then I just want to say also, as soon as this webinar ends, you'll be directed to a very quick follow-up survey. It would be very helpful if you could just take 2 minutes to share your feedback with us and help shape this conversation as we continue. The recording of the webinar will be available soon. You'll receive a follow-up email with a link to that. So thank you everyone for joining us. We'll see you next Tuesday for our expert panel of food innovators.